Hey there, health enthusiasts. In today's video, we're diving deep into the fascinating world of cordyceps mushrooms and exploring their remarkable health benefits. We'll uncover the science behind this ancient medicinal fungus and learn how it can help you optimize your well-being. From boosting exercise performance and fighting the signs of aging, to supporting immune function and managing chronic disease symptoms, cordyceps has a lot to offer. So grab a notepad and get ready to discover the power of this incredible superfood. For centuries, traditional Chinese medicine has revered cordyceps mushrooms for their potent health-promoting properties. This unique genus of parasitic fungi, which grows on the larvae of insects, has captured the attention of researchers worldwide. As modern science delves deeper into the secrets of cordyceps, evidence continues to mount, supporting its potential to enhance human health. Cordyceps mushrooms contain a wide array of bioactive compounds, including cordycepin, polysaccharides, and ergosterol, which work synergistically to deliver a host of health benefits. A 2020 review by Ashraf and colleagues and studies by Li et al. In 2006 and Young et al. In 2009 have highlighted the importance of these compounds in contributing to the therapeutic effects of cordyceps. One of the most notable compounds is cordycepin, a potent metabolite with a wide range of physiological roles. Ashraf's 2020 review and studies by Kim et al. In 2006 have shown that cordycepin exhibits anti-inflammatory, antioxidant, and anti-tumor properties, making it a promising candidate for various therapeutic applications. Polysaccharides are another crucial component of cordyceps mushrooms. These complex carbohydrates have been extensively studied for their immunomodulatory and anti-tumor effects, as demonstrated by Li et al. In 2006. Cordyceps polysaccharides have been found to stimulate the immune system by activating macrophages, natural killer cells, and T lymphocytes, thus enhancing the body's defense against pathogens and cancer cells, according to Li et al. In 2006 and Shin et al. In 2003. In addition to cordycepin and polysaccharides, cordyceps mushrooms contain a variety of other bioactive compounds such as ergosterol and other sterols. Yang et al.'s 2009 study showed that these compounds contribute to the overall health benefits of cordyceps by exhibiting antioxidant, anti-inflammatory, and immunomodulatory properties. The synergistic action of these bioactive compounds is believed to be responsible for the wide-ranging health benefits associated with cordyceps mushrooms. As research continues to unravel the complex mechanisms behind these compounds, the potential for developing targeted therapies and functional foods based on cordyceps extracts grows increasingly promising. One of the most well-known benefits of cordyceps mushrooms is their potential to enhance exercise performance. A double-blind, placebo-controlled trial conducted by Chen et al. In 2010 examined the effect of CS4, Cordyceps sinensis, on exercise performance in healthy older adults. The study found that CS4 supplementation significantly improved VO2 max, a measure of aerobic fitness, compared to the placebo group. Additionally, the cordyceps group experienced a notable increase in metabolic threshold, suggesting enhanced endurance capacity. Similarly, a study by Hirsch et al. In 2017 investigated the impact of Cordyceps militaris supplementation on tolerance to high-intensity exercise in young adults. The researchers found that both acute and chronic supplementation with Cordyceps militaris improved tolerance to high-intensity exercise, as evidenced by increased time to exhaustion and reduced ratings of perceived exertion. However, it's important to note that the effects of cordyceps on exercise performance may be less pronounced in well-trained athletes. A systematic review by Hirsch et al. In 2020 concluded that while cordyceps supplementation may offer benefits for untrained or moderately trained individuals, the effects on elite athletes remain unclear and require further research. The mechanisms behind cordyceps' ergogenic effects are not fully understood, but they may involve improved oxygen utilization, increased ATP production, and enhanced lactate clearance, as suggested by Hirsch et al. In 2017 and Xu et al. In 2016. As more studies explore the potential of cordyceps as a natural performance enhancer, athletes and fitness enthusiasts may find this mushroom to be a valuable addition to their training regimen. Another fascinating area of research surrounding cordyceps mushrooms is their potential anti-aging effects. As we age, our bodies become more susceptible to oxidative stress, inflammation, and cellular damage, which can contribute to the development of age-related diseases and decreased quality of life, as noted by Finkel and Holbrook in 2000. Several animal studies have investigated the anti-aging properties of cordyceps with promising results. A study by G et al. In 2009 found that oral administration of Cordyceps sinensis extract significantly extended the lifespan of fruit flies and aged mice. The researchers attributed this effect to the antioxidant properties of cordyceps, which helped to reduce oxidative stress and improve cellular function. In another study, Xiao et al. In 2014 examined the effects of Cordyceps militaris extract on aging-related parameters in a mouse model. The study found that Cordyceps supplementation improved learning and memory, increased antioxidant enzyme activity, and reduced markers of oxidative stress in the brain. While these animal studies provide valuable insights into the potential anti-aging effects of cordyceps, more human research is needed to confirm these benefits. However, the antioxidant and anti-inflammatory properties of cordyceps compounds, such as cordycepin and polysaccharides, suggest that this mushroom may indeed play a role in promoting healthy aging, as highlighted by Ashraf et al. In 2020 and Li et al. In 2006. As research continues to explore the anti-aging potential of cordyceps, this mushroom may emerge as a valuable tool in the quest to promote longevity and maintain optimal health throughout the lifespan. One of the most promising areas of research surrounding cordyceps mushrooms is their potential anti-tumor and cancer-fighting effects. Numerous studies have investigated the ability of cordyceps extracts and isolated compounds to inhibit the growth and spread of various types of cancer cells. In vitro studies, such as those by Yu et al. In 2012 and Liu et al. In 2008, have demonstrated that cordyceps extracts can inhibit the proliferation of a wide range of cancer cell lines, including lung, breast, colon, and liver cancer cells. These effects are thought to be mediated by the bioactive compounds found in cordyceps, such as cordycepin and polysaccharides, which have been shown to induce apoptosis, programmed cell death, and inhibit angiogenesis, the formation of new blood vessels, in tumor cells, as reported by Tully et al. In 2013 and Yu et al. In 2012. Animal studies have further supported the anti-tumor potential of cordyceps. For example, a study by Wang et al. In 2005 found that oral administration of Cordyceps sinensis extract significantly inhibited the growth of melanoma tumors in mice. Similarly, a study by Zhang et al. In 2012 demonstrated that Cordyceps militaris extract suppressed the growth and metastasis of lung cancer cells in a mouse model. While these preclinical studies provide compelling evidence for the anti-tumor effects of cordyceps, human clinical trials are still lacking. More research is needed to determine the optimal dosage, safety, and efficacy of cordyceps extracts in cancer patients. However, the existing evidence suggests that cordyceps mushrooms may have potential as an adjuvant therapy alongside conventional cancer treatments. The immunomodulator and anti-inflammatory properties of cordyceps compounds may help to enhance the body's natural defenses against cancer cells and mitigate the side effects of chemotherapy and radiation, as noted by Yu et al. In 2012 and Zhou et al. In 2009. As research continues to unravel the complex mechanisms behind the anti-tumor effects of cordyceps, this ancient medicinal mushroom may hold promise as a valuable tool in the fight against cancer. Type 2 diabetes is a chronic metabolic disorder characterized by high blood sugar levels, insulin resistance, and impaired glucose metabolism. Left unmanaged, type 2 diabetes can lead to serious complications, such as cardiovascular disease, kidney damage, and nerve damage, according to the American Diabetes Association in 2021. Recent research has explored the potential of cordyceps mushrooms in managing the symptoms of type 2 diabetes. Several animal studies, such as those by Choi et al. In 2004 and Low et al. In 2004, have demonstrated that cordyceps extracts can lower blood sugar levels, improve glucose metabolism, and enhance insulin sensitivity. For example, a study by Choi et al. In 2004 found that oral administration of cordycepin-enriched Cordyceps militaris extract significantly reduced blood glucose levels and improved glucose tolerance in diabetic mice. The researchers attributed these effects to the ability of cordycepin to enhance insulin sensitivity and glucose uptake in skeletal muscle cells. Similarly, a study by Low et al. In 2004 investigated the anti-hyperglycemic effects of Cordyceps sinensis in rats with diabetes induced by nicotinamide and streptozotocin. The study found that both natural and fermented Cordyceps sinensis significantly reduced blood sugar levels and improved glucose metabolism in diabetic rats. While these animal studies provide promising evidence for the potential of cordyceps in managing type 2 diabetes symptoms, human clinical trials are limited. A small pilot study by Ballon et al. In 2002 found that Cordyceps sinensis supplementation improved glucose metabolism and insulin sensitivity in patients with type 2 diabetes. But larger, well-controlled trials are needed to confirm these effects. The mechanisms behind cordyceps' anti-diabetic effects are not fully understood, but they may involve the regulation of glucose metabolism enzymes, enhancement of insulin signaling pathways, and modulation of inflammatory responses, as suggested by Li et al. In 2019 and Patel and Goyal in 2012. As the global burden of type 2 diabetes continues to rise, the potential of cordyceps mushrooms as a natural adjuvant therapy for managing diabetes symptoms warrants further investigation. With more research, this ancient medicinal mushroom may prove to be a valuable tool in the fight against this chronic metabolic disorder. Inflammation is a natural immune response to injury, infection, or cellular damage. However, chronic inflammation can contribute to the development of various diseases, such as cardiovascular disease, diabetes, and cancer, as noted by Hunter in 2012. Recent research has explored the potential anti-inflammatory effects of cordyceps mushrooms and their bioactive compounds. Several in vitro and animal studies, such as those by Ashraf et al. In 2020 and Kim et al. In 2006, have demonstrated that cordyceps extracts and isolated compounds, such as cordycepin, can inhibit the production of pro-inflammatory cytokines and mediators. For example, a study by Kim et al. In 2006 found that cordycepin suppressed the production of nitric oxide, TNFA, and IL-1B in lipopolysaccharides-stimulated macrophages, suggesting a potent anti-inflammatory effect. In vivo studies have further supported the anti-inflammatory potential of cordyceps. A study by Yang et al. In 2011 investigated the effects of Cordyceps sinensis extract on airway inflammation in a mouse model of asthma. The study found that Cordyceps treatment significantly reduced inflammatory cell infiltration, mucus hypersecretion, and airway hyperresponsiveness, indicating a protective effect against asthma-related inflammation. Similarly, a study by Zhong et al. In 2010 examined the anti-inflammatory effects of Cordyceps militaris extract in a mouse model of colitis. The researchers found that Cordyceps treatment attenuated the production of pro-inflammatory cytokines such as TNFA and IL-6 and improved the histological signs of colitis, suggesting a potential therapeutic role in inflammatory bowel diseases. While these preclinical studies provide evidence for the anti-inflammatory effects of cordyceps, human clinical data is scarce. A small pilot study by Kuo et al. In 2007 found that Cordyceps sinensis supplementation reduced the levels of pro-inflammatory cytokines in healthy volunteers, but larger, well-controlled trials are needed to confirm these effects in humans. The anti-inflammatory properties of cordyceps are thought to be mediated by the regulation of immune cell function, modulation of inflammatory signaling pathways, and antioxidant effects, as suggested by Ashraf et al. In 2020 and Chin et al. In 2018. As chronic inflammation continues to be implicated in the pathogenesis of various diseases, the potential of cordyceps mushrooms as a natural anti-inflammatory agent warrants further investigation. The immune system plays a crucial role in defending the body against pathogens, cancer cells, and other harmful agents. Immunomodulatory compounds which can enhance or suppress immune function have gained attention for their potential therapeutic applications. Cordyceps mushrooms have been studied for their immunomodulatory properties, with several studies demonstrating their ability to influence immune cell function and cytokine production. In vitro studies, such as those by Zhou et al. In 2009 and Kuo et al. In 2007, have shown that cordyceps extracts can stimulate the proliferation and activation of various immune cells, such as macrophages, natural killer cells, and T lymphocytes. For example, a study by Kuo et al. In 2007 found that Cordyceps sinensis extract enhanced the phagocytic activity of macrophages and increased the production of IL-12, a cytokine involved in the regulation of cell-mediated immunity. Animal studies have further supported the immunomodulatory effects of cordyceps. A study by Zhou et al. In 2009 investigated the effects of Cordyceps sinensis polysaccharides on immune function in immunosuppressed mice. The researchers found that cordyceps treatment significantly increased the proliferation of splenocytes, enhanced natural killer cell activity, and promoted the production of IL-2 and IFNG, suggesting a potent immunostimulatory effect. Interestingly, some studies, such as the one by Park et al. In 2009, have also reported immunosuppressive effects of cordyceps extracts, particularly in the context of autoimmune diseases. Park et al. Found that Cordyceps militaris extract inhibited the production of pro-inflammatory cytokines and suppressed the development of experimental autoimmune encephalomyelitis, a mouse model of multiple sclerosis. These findings suggest that Cordyceps mushrooms may have a dual role in immunomodulation, with the ability to both stimulate and suppress immune responses depending on the context. However, the effects of cordyceps on human immune function are less clear, as most studies have been conducted in vitro or in animal models. The immunomodulatory properties of cordyceps are thought to be mediated by the bioactive compounds found in these mushrooms, such as polysaccharides, cordycepin, and other metabolites, as noted by Zhou et al. In 2009 and Ashraf et al. In 2020. As the field of immunotherapy continues to evolve, the potential of cordyceps mushrooms as a natural immunomodulatory agent warrants further investigation, particularly in the context of infectious diseases, cancer, and autoimmune disorders. While cordyceps mushrooms are generally considered safe, it's important to be aware of potential side effects and drug interactions. Some people may experience mild digestive discomfort, such as nausea or diarrhea, when taking cordyceps supplements, as mentioned by Zhou et al. In 2009. In rare cases, allergic reactions have been reported, particularly in individuals with a history of mushroom allergies, as noted by Levy et al. In 2004. Cordyceps may also interact with certain medications, such as immunosuppressants, anticoagulants, and anti-diabetic drugs, according to Zhu et al. In 1998. For example, Zhu et al. In 1995 showed that cordyceps has been shown to potentiate the effects of immunosuppressive drugs, such as cyclosporine, in organ transplant recipients. Therefore, it's crucial to consult a healthcare provider before using cordyceps supplements, especially if you have a pre-existing medical condition or are taking medications. The optimal dosage of cordyceps supplements varies depending on the specific product and the desired health benefit. Most studies have used doses ranging from 1,000 to 3,000 milligrams per day, often divided into 2 or 3 doses, as reported by Zhu et al. In 1998 and Hirsch et al. In 2017. However, it's important to follow the dosage instructions provided by the manufacturer and not exceed the recommended daily intake. When choosing a cordyceps supplement, it's essential to select a reputable brand that uses high-quality, pure ingredients. Look for products that have been third-party tested for purity and potency. and avoid supplements that contain fillers, additives, or contaminants. In summary, while cordyceps mushrooms are generally safe and well tolerated, it's important to use them under the guidance of a healthcare provider, particularly if you have a medical condition or are taking medications. By following proper deuse,